with the leg. And it makes a lot more sense, you know, when we're talking about pelvic anterior elevation and you're just thinking, all right, what is this actually for? And then you show with the stepping and you see how the pelvis actually does go into anterior elevation. You can see how it all works together. For this week, we're going to practice the patterns of the pelvis, and we're going to do it without the legs. Okay? So for anterior elevation of the pelvis, same rules apply as we did for anterior elevation of the scapula. So I'm going to have her positioned in the same position, so hips are slightly back, shoulders are slightly forward. Okay? Man, no, let me get this underneath you, so you need something else under there. Better? Okay. So for this, when I did the scapula, I had to set the scapula in a neutral position. For her pelvis, I don't really need to set the pelvis. I just need to make sure she's not in a lot of flexion or extension with this. Okay, you want to be careful they're not right on a crack of a table because that doesn't work very well. But basically, I'm going to have her in this position, same angle. I'm going to have her hips at about 70 degrees. Okay, there's no absolute rule, but the hips are slightly less than 90. She's at about 70 degrees. Okay, so the direction that we're going to work is pelvic anterior elevation. It's anterior elevation and posterior depression is definitely the most important and the most commonly used of the two different diagonals. So when I'm training anterior elevation, what I'm going to do is first I make sure she's in a neutral position. I'm facing that same exact pattern. So when it was her scapula, I was right here so I could be in the line. For her pelvis, I'm right here so I can be right in the line. My hips and shoulders are facing that direction. Okay? What I'm going to start doing is rhythmic initiation so she can get a sense of how I'm moving her. Okay, so rhythmic initiations, I'm just going to grab onto your pelvis and I'm going to bring you down and bring it back up. So I'm bringing her into anterior elevation, and this is then bringing her into posterior depression. Okay, you can do it several different ways with your hands. I tend to use my hands and my forearms to do it. So if I bring her up into anterior elevation, I bring her up and I can actually push with my forearm to get her there a little bit. Now we know, I talked with the scapula that it had a very loose attachment to the axial skeleton. With the pelvic girdle, that's not the case. You can't just move the pelvis independently of everything else. So of all the motions that I would see in her spine, it's okay to see some side bending. I'm going to get some lumbar side bending. When we do functional mobilizations, that's how I do a lot of my lumbar mobs with my side glides, because I know what happens to the spine with side bending. I'm not getting rotation and I'm not getting extension with it though. Okay, so if I bring her into anterior elevation, I can see she does do some side bending. Here's anterior elevation of her pelvis. If you're not comfortable with that grip, I can also have a hand, or right here, a hand on her anterior aspect of her crest and a hand down on her ischial tube, and I can just bring her rhythmic initiation into anterior elevation and posterior depression. Okay? So this is just passive rhythmic initiation. So again, if it was the way that I like to hold on, is I'll get here and I'll just start moving my patient. Okay? And a lot of patients, when you just start moving their pelvis, especially male patients, especially male back pain patients, they haven't moved their pelvis in years. And you start getting it moving, and they're just so floored when you start moving that they even have that kind of movement. But you can't just get on their pelvis and say pull up or push down, because that means nothing to them until you actually show them, all right, so see how, this is how I would do it with the patient. See how far down I can bring you here, and I can bring you all the way up. Feel all that motion that you have in your pelvis. Okay, so here's my rhythmic initiation. All right, keep those pillows on your side. All right, so now I can go from my rhythmic initiation and now say, now just start doing this motion with me. And I'm not resisting her, I'm just guiding her with it. Okay, so I didn't have to change my hands. Okay, now what you can see, what's your name?
Caroline.
With Caroline, she's got an extension bias in her lumbar spine. You can probably see that as she's coming back down especially, she wants to hinge right there. Okay, so this is kind of evaluation with treatment. So I see, all right, there's some things that I might need to address in there. For the sake of this, I'm not going to address them. The only thing I'm going to do is bias her into a little bit more flexion and bring her knees up a little bit more. I'm just going to let you tuck your chin a little bit. Okay, and I just want to see if that gets her a little bit out of that extension bias. Okay, but she's still got a tendency to go into extension. All right, but for right now, I'm just going to do my rhythmic initiation. And now, as I want to go in, just like we did with the pelvis, if I want to do a quick stretch and start to resist her, I've got to change my hand contacts. So for a female pelvis, this is a lot easier to do. I'm going to take one hand and put it just above her iliac crest. So if here's her crest right here, I'm going to come just above her crest, and I'm going to lock on her tissues right here. Now, it doesn't matter how thin someone is. If you come in above their crest and just pull down, you're going to pinch them, and it's not going to feel good. So I'm going to come on pretty firm above her crest, take up some soft tissue, and lock on. So this should feel pretty firm, but it's not real uncomfortable. So I've got it right here. Okay? This hand can go right on top, or it can go slightly in front. Okay, so now as I bring you down, I'm going to take her to her end range. I'm going to quick stretch and resist just like I did with the scapula. So I bring her down here, and now all I want you to do is go ahead and pull up, and she's going to right there, and let it come down. And pull up, and back down, and pull up. So she's pulling up into anterior elevation right now. Okay? You can let it relax. For a lot of patients, you go to do that and they have no idea where you want them to go, even after you've done rhythmic initiation. So in that case, a lot of times I'll just start them at their end range. So if I bring you, I might say, all right, feel how I've got you pushed all the way up here, so you're curled up, and I want you to just try to keep it there. Don't let me move you. And I just start getting her to engage her trunk in this position. We'll do a lot more of this with the leg next week. Okay? So now I'm just getting her to engage, and she's really working her trunk right now. You should feel that. Okay, now I can let it slowly come down. Good, and now pull back up. And she knows where I want her to go now because she's already kicked in those muscles in that position. Let it slowly come down and pull back up. Okay, so she's felt what it feels like to get those muscles to engage in that position. So now when I bring her all the way down and say pull up, her body knows where I want her to go. Okay, so that's anterior elevation. Okay. So you're off the hook for a second. Can I have one of the guys